Good afternoon, Mwangi. Thank you very much for coming on to give us your time.
Good afternoon. Very happy to.
I was really interested today to talk to you about COVID-19, of course, which everyone is talking about. But most of what we hear is analysis about developed countries, Italy, what's happening in Italy is going to lead to effects in the UK or the US. But what we don't hear about is what is happening in Africa and how that might play out. So what's it looking there? What's it looking like there at the moment?
So initially, partially, there isn't that much going on in terms of infections, or at least infections that we know, which is part of the story, right? Part of the story is because Africa is not as well linked to the rest of the world. It takes a little longer for the virus to get there. I think the latest we have is about 600 cases in about 33 countries right now, with Egypt leading with just over 100 and something cases. So there's, at least from what has been tested, the positive cases, it's rather low. And there has been some question of whether it's because the testing itself is rather limited, or is it actually low? So there have been some questions like that, but there are other indications which suggest that even if the numbers are below what it actually is, that we would expect it to be rather low. One, as I've said before, the kind of relatively few connections to the initial hotspot. So, for example, if we're talking China, the entire continent has only 8 daily flights to China, to entire China, not just the province that was affected.
So this is in spite of the huge economic links that have grown between China and Africa.
Yeah. So you can see there, you consider that, compare that to any other place, right? Compare that to a spot in Europe, there are much fewer flights, for example, and therefore much fewer people going back and forth. If you think about, let's say, another carrier, which would have been tourism, Africa only accounts for 4% of Chinese visitors or Chinese tourists in the world. So even though these numbers may be large for African countries themselves, in terms relative to the globe, they're relatively small. Right. So that part of it, that kind of human to human contact is relatively limited. The other part, which, here I'm not a medical doctor, and this is more something, just thinking of the past, for example, pandemic of SARS, that was also very limited in the African context, right? Extremely limited in the African context. So was the H1N1. Now, I'm not saying that this one will follow that pattern, but those two were very limited. We're also talking about a different flu season, and I don't know to what extent, the flu season, when the flu season is kind of in the northern hemisphere versus the south, how much that also might have an impact. So with those others, H1N1 and SARS, SARS I think hit Africa 4 months after it hit the rest of the world.
Okay.
For example. So there might be a delay also. So the other part is that you do expect to see this delay. So there's that part of the story, which is right now, it's not a big issue. I do, however, expect cases have started, very rapidly increasing. We've seen doubling of cases in countries like South Africa over a couple of days. So we should not underplay the fact that this is potentially going to be a big crisis for African countries.
Can I just ask you about testing? Because
yeah.
I know one of the issues in the US was the huge cost of testing, wasn't it? Which I think now has been addressed.
Yeah.
But would that be a similar issue in Africa?
I'm not sure, given the support that there is. I don't know what the cost of the actual test kits are, whether the cost itself is going to be the problem or getting out the kits to everybody.
Yeah.
Africa, after Ebola, the African Union actually put together an African Center for Disease Control and Prevention.
Okay.
Which is based in Addis and is part of the lead group on this. And so far, actually, despite, I think that the fact that there are still issues, they've done remarkably well with the fact that right now, I think over 41 countries can both take the test and do it locally, test for the virus locally, which is a huge improvement. At the beginning of the epidemic, there were maybe one or two centers on the continent which could do it, but as of now, there are 41 countries that can do the test. I think there's also a little bit of infrastructure that comes out of the Ebola virus.
Right.
So some countries have the capacity for creating mobile labs to do the testing fairly easily if they have the right, they'll have the equipment, whether they have the right reagents, etc., to do the specific test. So that experience, that infrastructure can be rolled out for this. And we've seen in some cases, surprised by tourists where they, I think I was reading on one blog where, a US tourist ended up in Uganda and was surprised at how relatively thorough in the incoming quote unquote testing was, although it doesn't have the same impact, right? Because we know that you can be can never say the word,
not having symptoms.
There you go.
Asymptomatic.
Yeah, not having symptoms. But he talked about going into Uganda, getting the his temperature being checked, and then hand sanitizer being available, a place to wash your face being available immediately that you got off the plane, before you went on through the passport control and customs. And this was partially from the Ebola virus thing. So there's a little bit of infrastructure in some countries to do this. So WHO, the World Bank have put aside some money to get testing done. So I think that the logistics may be the bigger problem rather than the actual cost of the test.
Okay.
And the availability of the test.
Right. So presumably, though, there is no way that Africa is going to avoid going through the same cycles that have happened elsewhere, is it? I mean, there's no particular reason.
There's no particular reason. I mean, the one advantage African countries have had, which hopefully they've not squandered, is the fact that it's taken longer to get to them. And so some of the things like social distancing have occurred much earlier in the process than in other places. So if we talk, in the East African countries, I think practically all the countries now have already closed the schools. And we're still talking about places where the number of known infections is under 10 or in the low 10s.
Okay.
So they've gone there earlier.
If they follow the now what seems to be the recommended approach of suppression,
Yep.
Firstly, how easy is it for them to institute a really effective suppression?
Yep.
And then how is that going to affect the economic activity?
Mm-hmm. Yeah, I think there are a number of challenges here. And let me take them, I think, spatially first. Spatially and then by income. So spatially, I think, one question is, how do you diminish social contact in, for example, in the slum areas of major urban cities, right? Where there isn't really space for people to be apart from each other, in the sense that we are talking about it.
Yeah.
Right. So I think that's going to be a problem. So that if the virus gets into one of the largest slums, you have a problem because people can't actually social distance, and they can't even necessarily do the simple things like constantly wash their hands because there is a problem of water and sanitation. So the limitations of water and sanitation combined with the close quarters that people are living in and the lack of that space that, we're lucky to have in the West is could be a problem.
And what percentage of Africans live in cities then now?
It's very varied. It's anything from 30 to 60%,
right?
Depending on the country. There's some countries which are still very rural. East African countries are very rural. Southern African countries are much more urban. So are increasingly our West African countries, and many of these countries are also what has been called capital centric, where one mega city is attracting all the people. So it's going to be varied across the continent in terms of the degree of urbanization and also the degree of informal settlements where the conditions could be really bad.
So do you think when people begin to understand this, do you think people living in these circumstances still have the connections into the countryside? So could they depopulate and go back to their original villages?
Yeah, so in some cases people can do that, but I mean that carries the risk of spreading the.
Yeah, they'd have to move fast.
Yeah. So that carries the risk of spreading the virus, but I wouldn't be surprised if some of that happens. I mean, it was often, but this was a long time ago. When I was younger, that was one way to respond to crisis, which is if you had a crisis which was affecting the urban areas, you would send at least the children back to the grandparents in the rural areas. So that might be, some people might try that.
Okay.
Now, the difficulty in the rural areas is that whether people will have the capability to self-isolate. So if you are in places where you may have some more space vis-a-vis your neighbor, right? But then do you have the resources to self-isolate? Do you have the resources to purchase food and supplies for a long enough period to actually self-isolate? And then also the question of how soon do we find out about the cases in the rural areas? So it could spread in rural areas, especially if it has low impact, right? But you don't have people necessarily dying, but rather has low impact and people just think it's a low-grade fever, low-grade flu, it could spread quite rapidly. So there are those two. Then across the continent, there's a question of just income and the ability to self-isolate. We're talking about an economy where many people purchase, let's say, food on a daily basis or every couple of days, often from street vendors, and don't do, right? The middle class that can do kind of weekend shopping for the week and have a fridge to put away the food is very small.
Yeah.
Right? So it becomes even more difficult to self-isolate and for people to follow those rules of self-isolation, right? Just because they don't have the luxury of doing that. So I think those are things we should be aware of in terms of how well the self-isolation strategy may work for the continent.
So do you think that there's a likelihood that governments will try different strategies, given that those, or you know, what are governments likely to do?
I don't really know. I mean, one can speculate that some governments might try, and governments which are more heavy-handed might go down the Malaysia path, right? So Malaysia has decided that people aren't self-isolating, and so it's calling out the military to enforce self-isolation from this weekend, from this Sunday. So I can imagine some countries trying that. I think it depends on how it plays out. I think, how do the numbers remain relatively low to the rest of the population in terms of death? I mean, the flip side of all of this is the one advantage that Africa has is that it has a young population.
Yeah, I was thinking about that, yeah.
So, 50% is under 15. So is it the case that we don't get as many? I'm not predicting that we won't, but I'm just saying, is it the case that that plays a role in minimizing the number of deaths, and therefore helps out in some way? So, I think one is not sure how governments will respond in this case. At one level, I think it's a little bit unprecedented in the sense that even though things like Ebola were large and scary, it was a much more visible virus, I think, than this. This seems like something that can silently go through a community before you realize that, there are a lot of people infected.
So maybe, there is a sort of scenario where actually suppression just doesn't work, and actually, to some extent, herd immunity sort of happens anyway, and the death rate is, because of the population, the age gradient, if you like, is not so bad, but still it's, I suppose it's still going to be large numbers of people, and then the health system will be presumably overrun. Yeah,
so I don't want I don't want to think of it actually as, I know what you're saying by herd immunity, but in the interest of not getting people to downplay the risk, right? I don't want to say that.
But it was interesting, that here in the UK,
I know
it seemed the initial strategy was to develop herd immunity till they did the modeling that suggested that the whole health service would be blown away before any herd immunity, even if it did, might arise.
Right. The problem with herd immunity is then we're just talking about a proportion of the population, right? So they're going to be vulnerable people. The elderly are going to be vulnerable. You just effectively write them off.
Yeah.
Right. And then they're going to be, Africa does suffer from other diseases, pneumonia, etc., which may make you more susceptible to it, even if you're young, right? So if you're suffering from these other complications, which you could be suffering from, and you could suffer from those when you're young, so those people also may get hit. So I'm not sure that the herd immunity, given the poor health system and the other disease burden that African populations have, will necessarily work out with fewer deaths.
I was thinking more that might by default, but assuming governments will then attempt suppression.
Yeah.
Obviously, one of the elements of this strategy in the West has been to look at how to keep people alive economically while they self-isolate because they can't do their jobs and so on. Now, what possibilities are there for African countries to provide that sort of support?
Most African governments don't have the fiscal space to be able to do that, and that's going to be a big challenge. In fact, I was reading one report on Kenya, which said, the questions that people in the rural areas asked were exactly around this, which was, okay, fine, you asked us to self-isolate. Does that mean the government will be bringing food, will be providing us with food and stuff to survive during these periods of self-isolation? And, I can't think of governments that are in a position to do that. So that's going to be an issue. I think without more international support, it's going to be very difficult for African countries to do the kind of things that people are talking about doing in the West or in industrialized countries. They just don't have the fiscal space to do that.
So could Africa, say in the West that we do get on top of this disease, we put in all these controls. Now, that means also that a large proportion of the population will remain vulnerable to catching, obviously, until there's a vaccine.
Yeah.
During that period, presumably, there may be a tendency to keep excluding people from Africa, and maybe which could reduce trade exchanges and so on, because of the perceived danger of infection from there.
So there's a long-term impact. There's going to be a long-term impact in growth. You're going to get both demand and supply shocks in African countries, right? Demand shocks in the sense that there's been a global slowdown. A fair amount of trade had turned towards China. Not as big as we often imagine, but a fair amount in terms of, if you think of proportions vis-a-vis the West, etc. And so that fall in demand by China for raw materials from African countries is going to put some countries on the precipice. The flip side is also a number of countries have become large importers of Chinese goods, inexpensive Chinese goods. So they've replaced their imports, often from other places, with Chinese goods, and those are not going to be available, or when they're available, will be available at a much higher price. So those two sets of things, those two sets of shocks, is likely to impact African countries for a long while, past the immediate crisis, right? And I think it should bring our attention back to the need for not only fair trade for African countries, but also for African countries to engage in a diversification of their trade and also engage into some more local capabilities, right? That African countries should not be overly dependent on trade as is the case now, where imports and exports are extremely large part of GDP for most countries. And, there should be a substantial local economy where there's production of goods and services which are for the country itself.
But I suppose one of the trends that it seems to be emerging is that China seems to be using this opportunity to increase its global influence and contrast itself to the sort of American first language, and making a point of helping other countries around the world. And I wonder, given the extensive relationships with African countries, whether China could see an opportunity to further build relationships, influence its status by becoming a sort of savior, and maybe even, offering all the expertise it's gained to African countries.
No, absolutely. I think you're absolutely right. On one list I was on, somebody said something interesting, which was, hey, look, why are we sweating this when we know there are literally thousands of medical specialists in China who've just gone through 3 months of this? Couldn't we import, employ some of them?
Yeah.
To help run the system. And this reminds me in a sense of what happened with Chinese construction companies, right? So China went through a fantastic boom building infrastructure, right, from the 80s through the 90s. And as its own infrastructure spending or its own need for new infrastructure slowed down, what did it do? The construction companies went outside China, right, and started building infrastructure outside China.
Yeah.
And so, in a sense, in a much smaller window, you have it using now the medical expertise. It's gotten the supplies. I mean, they were producing 50% of the face masks before, and they ramped up that 10 times over the last 3 months. So that's going to build a stronger connection to Africa and also to the rest of the world, maybe with the exception of the US. I mean, the support they're trying to give to Italy.
Yes.
So,
a health Silk Road. A health Silk Road is the phrase.
Yeah, so it is a game changer. It could be a game changer in that sense, in terms of the role they play on the world stage. And it could tie African countries more closely to China. But, at this time of crisis, you don't look a gift horse in the mouth, right?
What about the potential to go more local, as you suggested? I mean, I was wondering whether, actually, if you're a subsistence farmer, you would have advantages, because obviously you're not so reliant on having to, go out to buy and so forth. And is there potential for an increasing boost to subsistence farming as more people come back into the countryside, or are they actually going to overwhelm the capacity?
Well, I mean, I guess it depends on when we get hit in the season, right? So if people are getting hit in the planting season, then they're already low on food.
Yeah.
They probably depend on the market. So it depends on when they get it in the season. But yes, I think in terms of thinking long term, one response would be to say that, look, what are the things that we absolutely have to do for ourselves if trade and transportation shut down? I think one thing that's actually pretty phenomenal in a negative sense about this is I don't remember in my lifetime the kind of shutting down of international connections that have occurred around that are similar to this.
Yeah.
Right. Even during SARS, there wasn't a shutting down of the connections. There was kind of monitoring them. Right. But here now countries have just, and many African countries very early on, cut down the number of flights or cut out flights from European countries, from China. So I think going forward, if countries take lessons from this, and they should, one of the things would be to say, okay, how do we handle situations when we can't import things for a period of time? What are the things that, regardless of the cost, we need to be able to produce for ourselves? And I think it's potentially the case that countries could learn from this. I mean, think of the 97 kind of foreign exchange crisis that came out of East Asia, the foreign exchange crunch. And, developing countries responded by holding much larger foreign reserves than they have in the past.
Right.
Right. So there was a bump up in foreign reserves. If people start talking to each other, if African countries start talking to each other, also to other developing countries, then they might say, look, so it is a case that we could get cut off. It is a case that we have these viruses that could have these kinds of impacts. What do we need to do to be prepared for them? Just as we've prepared for Ebola, what do we need now to be prepared for where we get cut off? And so that, I hope, would be one of the lessons that comes out of this. And so a different thinking about development and the development of the local market. So a turn away, well, I don't want to say a turn away from simply exports, but a re-emphasis on local production, which has kind of been lost in our present models of development, which have been kind of export-led development.
Well, thank you very much, Mwangi. I think it'll be great to return to this topic maybe in a few months' time to see where things are actually going and what strategies different governments are using.
Yes, it's something we should do and discuss then.
Brilliant. Well, I'll look forward to that. Thank you very much.
Thank you.